got into healthcare because that happened to me. I saw what happened to my roommate, Will, and I didn't want that to happen to anyone again. And we're solving the problem for the health plan first and foremost. Our solution sits on when the prior authorization request or the utilization management request is received by the health plan. There's a set of archaic steps that exist today, from fax machines, a human manually typing that information from one system to another system, then asking nurses to sift through PDF documents that can be 5, 10, 50 pages long, trying to find the one piece of information they need, and then read medical policy guidelines, which are designed to be read by computers, not by humans. There were things that we thought were impossible, things that we thought that were really hard 3 months ago that are now completely possible with the way that MCP has evolved and the way the different models have evolved, and costs are being driven down in terms of what the actual token costs are. And so just focusing a little bit more on what's the problem we need to solve, and let's know that the AI is going to get there, or we can help push the AI to get there such that we can accomplish those tasks.
Chuck, I'm so happy to have you here today.
Yeah, I'm so glad to be here. Thanks for having me.
Thank you so much for being here today. Chuck, can you tell me a bit about what inspired you to start Latitude Health? What you guys do, and how did the journey start?
Sure. Let me take you back a little bit to sort of the founding of the company and sort of where this journey began and how we ended up here. So when I was in my early 20s, I had a severe eating disorder. And I actually ended up in inpatient treatment for 3 months, followed by outpatient treatment, followed by partial hospitalization. And I'm a success story. I was super lucky. My insurance covered the entire time that I was there. I was able to overcome the disease, and I'm thriving today. But my roommate in treatment not as lucky, Will. Will was discharged too early. His insurance stopped covering his treatment. They thought he was ready to go home. And 6 months later, Will had passed away from complications of the disease. And it wasn't a failure of the doctor. It wasn't a failure of a nurse. It was a failure of the system, where archaic technologies, siloed information, data that didn't talk to one another, didn't allow that health plan making the decisions to really see the full picture of Will, and saw what I saw every day, is that he wasn't ready to go home and he had not beaten this disorder. So we founded Latitude to make sure what happens to Will never happens again, that patients get the right determinations, health insurance companies are covering the right care. And we do that by making sure that we are presenting the right information to decision makers at the health plan. We are looking at the medical necessity guidelines, and we're helping them make the best determination possible for every patient that's sitting in front of them. And so I've spent my entire career in healthcare trying to move along that journey, trying to make healthcare better. And when I saw the opportunity where AI was coming, we could make decisions better. We can automate the manual tasks that nurses and clinicians and medical directors are doing today at health plans, and allow them to get back to clinical decision making, which is really what the most important thing is, and making sure that the right information gets to the right person at the right time. That's where the opportunity is. And so we've leapt on that and have been heads down building Latitude for the past year and a half.
Gotcha. So let's say I'm a healthcare executive and I'm listening to this, and I run a hospital or I run a private practice. So what are the problems that you're solving for me?
So we're actually solving the health plan. We're solving the problem for the health plan first and foremost.
Hmm.
So our solution sits on when the prior authorization request or the utilization management request is received by the health plan. There's a set of archaic steps that exist today, from fax machines, a human manually typing that information from one system to another system, then asking nurses to sift through PDF documents that can be 5, 10, 50 pages long, trying to find one piece of information they need, and then read medical policy guidelines, which are designed to be read by computers, not by humans, with these deep sets of nested criteria. And all of that makes a job that is supposed to be clinical into an admin or operations job for 75% of the work. So we automate all of those tasks and get the right information to the right person. Now, for the provider, who's the one sending the request for service, and as I'm sure you hear, every provider, every patient hates prior authorization. It delays care,
Oh
it gets
yeah.
the wrong outcomes, patients get denied. What our solution does is it gets determinations faster. So patients get the right treatment faster, they get the most appropriate care. And when care is denied, we are helping the clinicians on the health plan see the exact black and white reasons of why that's the case. So there's no longer this ambiguity. We reduce the frustrations, and we help both parties actually get to decisions faster and know where those gaps are between what's covered and what is not.
Gotcha. So it's if we want to explain this in simple terms, it's a communication tool between the payer and the provider or slash the physician.
I think of it more of an automation tool. It's using
Automation, exactly.
AI to help.
That's the right word.
Yeah,
Automation
yeah,
tool. Yes. Yes, it's not
How
only
how do you
communication.
make both sides of the fax machine actually talk to each other better? Because that's
Gotcha.
inevitably what's sitting in the middle of this, and the person who's most impacted by this is the patient who's trying to get care. And if we speed that up, if we make those decisions faster, we make them better. The health plans save money on it from an efficiency perspective, and the patients get the care they need faster, and the providers can get back to practicing medicine rather than doing all the red tape and administrative things that are around submitting prior auth today.
Gotcha. Gotcha. And before being a founder, I read in your background like you were also working with venture capital, right?
Yeah, I've sort of done the operation side, working at health plans. I've done the investor side, actually investing in startups, and I've done the startup side, actually building companies that are venture backed and selling into health plans. So Latitude was sort of the culmination of those three things, having this deep operational experience of knowing what looks like to work at a health plan, how the UM function works today at a health plan, as well as knowing like what it takes to build a company and actually put all that together. Now it's a little bit different actually being in the CEO and founder seat than it is, the one who's just working at the health plan or working at the startup. But that's where those three sort of converged for me to take on this opportunity.
I want to expand a bit. So I'm always interested in people who like they've been on both sides of the table and they carry lots of lessons. So what lessons did you learn when you were like on the other side of table and now as a founder? Like let's say I'm a healthcare founder, I'm listening to this episode, and what tips would you give me for raising money or like convincing venture capital or investor uh, the importance of my dream?
Sure. Couple things. The basic ones, right, are how big is this opportunity? What's like the total market size you can go after? How painful is this problem to the end users that you're solving it for? And then how are you going to do it? What's your secret sauce? What's your moat? What's your differentiation that's going to allow you to achieve that? And so you have to be able to know the market inside and out better than your investors and better than the people for whom you're solving the problem for. And I think that's critical, right? There's a lot of people who said, okay, AI is great. We have this thing, the new thing that does all these things. And healthcare is an industry where there's a lot of waste, there's a lot of spend. Great, let's go build solutions for healthcare. But if you don't actually truly understand the operations of a health plan, or like what we were talking about before the show, right? Like how a clinical researcher is actually making decisions, or what the support actually looks like, or how your specialty matters, if you don't understand those things, you're going to build a point solution that doesn't actually solve a pain point. And what we've done at Latitude is map out what is the journey end to end and solve for that entire workflow for the utilization management process for health plans. And so you have to be hyper specific in knowing who your end user is, what their problems are, how those problems vary between different customers. Because if you've seen one health plan, you've seen one health plan. And then you have to be able to educate that simply to the investors and help them understand why people are going to pay you to solve this problem and why they're going to pay a lot of money to do so. Because the impact you're going to create is. So, how do you take a very complex set of procedures that happen today and then distill that into something that's understandable while telling the bigger story about where the opportunity exists? And for us, it's a massive market. We help multiple different segments, not just payers, but workers' comp, TPAs, as a service, IROs, all have the same inefficient problems. And we're building as members the right decision every time and focuses on helping get appropriate care and appropriate cost while we get all the efficiency gains of the automation that we.
Gotcha. So I think AI is being like overused now, and like many solutions have AI, which is there is nothing wrong in that in that. And but also at the same time, we need a human in the loop. Can you tell me what does the AI do when it comes to Latitude Health? And do you need a human in the loop also to complement AI's work?
Absolutely. Great question. And this is where the market is pushing back a lot on this, right? You're seeing regulation, you're seeing articles, you're seeing things in the press where everyone's saying, we don't want AI making decisions. We don't want AI telling me how my care should be delivered. We don't want AI denying claims or denying authorization requests. And we completely agree. We're not in the business of auto approving. We're definitely not in the business of auto denying. We're in the business of getting the right decision and using AI to help the right information get served to the clinician. So what our AI does is take that medical, which is often a PDF document, which consists of EMR data, handwritten notes, labs, imaging, all dispersed across 500 pages, and distill that down into discrete structured data. So I can ask any questions of the data, I can find the information that I need really easily, and I can make sure I'm not missing anything. And then at the same time, we take the medical necessity guidelines and we break those down into structured discrete pieces, and then we map them together. So I, as the clinician, can find everything I need within that medical record to help me make the decision. I can compare it to the guidelines that exist. And then our system actually makes a recommendation. It says, based on the criteria, based on the medical record, here's what we believe should happen. And we're just making the recommendation, though. You, as the clinician, make the final determination. We're a co-pilot or a tool for you to do that. And that type of AI exists across our entire system, from intake to clinical review to communication, all the ways that we're assisting the human who's doing those things. And then in terms of how we're designing the models and training the models, we've got a deep set of expert clinicians who are nurses, doctors, medical directors, chief medical officers, who are helping us fine tune the models to put in that clinical context and the clinical relevance to all that information to help it be structured in a way as a review nurse or a medical director would look to be using that information to make those determinations. So you nailed it. The human is a critical part of the process in making the final determinations, in training the data, and tagging the data, and helping us do that such that the AI can operate seamlessly and help them make the right decisions faster.
Gotcha, gotcha. Going back into Latitude, I still like want to distill more from your experience. So one day you woke up and you had this great idea and you want to build company, but like building in healthcare is very hard, as like everyone knows, because like your user is not your payer is not your provider is not your user. It's crazy cycle. So what are the challenges that you faced to build Latitude Health? What were like the bottlenecks? Like, how did you build the team? How did you raise money? Or like maybe there are other challenges that you face, and I'm sure there are. Like, what are the important things that you can think of?
Yeah, really fun question. So Latitude is backed by Redesign Health. So Redesign's a venture studio based out of New York. We got with very early on to help put together sort of this model, a white space, use their deep set of industry advisors and researchers and clinicians to really help us understand the market space in incredible depth before actually launching the business. So that was step one. I think the next part was then, so that gave us some initial backing as well to get things off the ground. And so then how do you build a team of the right people that not only understand the problem, but can actually build for where the solution needs to be and use the latest and greatest AI? And so in that case, my co-founder, Guru Nadiger, who's our chief product officer, deep experience in actually building some of the legacy platforms that payers use today, knows how inefficient they are, and is also stands to the latest and greatest in AI, and then building our solution in a way where we can interchangeable models. We can have different agents do different tasks. We can use one LLM for one task and a different LLM for another task, and then bring those together and maintain that flexibility. So that was another critical component of it. And then the third thing is, and this is the hardest thing about selling or billing in healthcare, is the actual sales cycle. So how do you get in front of payers? How do you get them to move faster? These sales cycles are notoriously 12 to 18 months on a good day to get something across. Luckily, I've done that before in previous startups, and I've worked on the other side of the equation. So knowing what that process looks like and how do you help actually guide your users through that. One recommendation I always have to founders is you've probably trying selling to someone who's actually never taken something through procurement, that actually never purchased software for their organization. So they don't know what it looks like when they give you the thumbs up about what happens after that. There's a procurement team, there's a financial decision committee, there's a clinical ethics review, there's a security protocols. Map out for them that journey up front and say, this is what we have to do from here, and agree to the timeline and keep everybody accountable to that timeline as you move through that procurement process. That was a critical unlock for me in my previous companies about how do you get from a yes decision to an actual contract being in place. The last thing I would say, and then I'll shut up and let you ask more questions, is around just how fast AI is moving. That's been the biggest challenge slash biggest opportunity,
Yeah.
where there were things that we thought were impossible, things that we thought that were really hard 3 months ago that are now completely possible with the way that like MCP has evolved and the way the different models have evolved, and costs are being driven down in terms of what the actual token costs are. All those are now making so much more available to us. And so just focusing a little bit more on what's the problem we need to solve and let's know that the AI is going to get there, or we can help push the AI to get there such that we can accomplish those tasks rather than being beholden to the technology that existed at that moment because it's just evolving so fast.
Gotcha. I still want to focus on the problem that you're solving right now. I would say what you guys are solving, it's not something like the regular founder like can think of. Like it requires lots of like deep knowledge of healthcare, how the system works, how the systems communicate. So how did you gain that insight? Like how did you wake up one day and realize, oh, there is this problem in healthcare and like I want to tackle it? Like what gave you that insight and how did you learn more about it?
Yeah, it's one of those sort of unsexy problems in healthcare that like you only know if you've worked in the belly of the beast.
Yeah.
It's not like all the cool, like fitness tech and sleep tech and wearables. Like everybody knows about that stuff. But this is, if you've worked at a health plan, you know two things. In order for a health plan to be solvent and successful, you have to be really good at paying and managing claims, and you have to be good at utilization management because those are the only real two levers that you have to control costs. We want to talk about provider performance, like a better doctor makes better decisions, they're more efficient, they get better care from their patients. Yes, that will control costs. But why do you have utilization management in the first place? It's to make sure members get the most appropriate care and that costs are managed effectively for everyone. Because if there was no gate to say, like, is this the most appropriate care, two things would happen. Providers would have no sort of check on what they're requesting for services and just do, hypothetically, do a bunch of inappropriate care for patients. We don't believe that's actually the case, but that's sort of the fear that health plans have. And the second thing is, how do we make sure that's the right care? Often, a provider may say, I think this provider needs, or this patient needs knee surgery. But if we look at the medical necessity guidelines and say, well, has this patient tried physical therapy? Have they tried a cortisone shot? Have they tried less invasive methods before they go down the surgical route, which can be great for their knee, but it can also be very costly if things go wrong or they didn't need this type of treatment. And so as you understand that and you've worked in the health plan, so you understand like why this thing exists in the first place, you can also start to understand why hasn't it been solved today? Why is this process still so inefficient? And it's because it runs on technology from the 1990s. It's fax machines, it's old legacy platforms that don't have any AI, don't have any automation. They're just sort of presenting the PDF to a nurse who still has to dig through it all. And so when I started my career at Group Corporation and then working at a company called Next Level Health Partners, which I helped co-found based out of Chicago, and then going back to Anthem and working there again after business school, that problem still persisted. It just still had not been solved. And you think that it would, but nobody's really focused on it because it's sort of this like non-sexy layer of just the core administrative part of the health plan. And so that's when I saw it, and that's when I started to connect the dots. And I shared my story in the beginning, which was I got into healthcare because that happened to me. I saw what happened to my roommate, Will, and I didn't want that to happen to anyone again. And so I've been continually sort of following a career path that's like, what is the next step in that journey to help me get closer to solving that problem? And it was after all that came together and building startups and working at health plans and investing in startups that it was like, okay, here's this course layer where the decision is actually getting made on the red light, green light to patient care. And if we can help make decisions better there, then we can solve a bigger problem of making sure that patients are getting the right care at the right time. So I think I sort of went a roundabout way of answering your question about like, how did this come to be and why do we focus on this? But I'd say it's that actually deep experience working in health plans to truly understand why hasn't this problem been solved yet? Why does it still exist? And is it a solvable problem that we should be focused on building a solution for?
No, I completely agree with you. I think like the unsexy or unattractive problems are the things that are the ones that need to be solved. And that's, to be honest with you, I think that's where the money is. If I want to improve something, it's like something related to insurance, it's something related to payment. Because like you can come and bring me the most attractive, sexy AI out there, but like to be honest with you, healthcare is not looking for attractive solutions. We still have like so many problems, basic things that needs to be solved, like insurance like funny enough, I was listening to a book and I didn't know that this model exists. It is called direct primary care, where it's a
Hmm.
payment model where people like sign up for $50 or $60 or like whatever X amount of money, and they buy a membership with a family doctor, and that will be on top of their insurance, but they will have access to this person like 24/7, and he will take care of them. And this is cool thing to do, to be honest with you, but also not everyone can do it. And on top of that is like you can't apply it for oncology, where each drug is like $100,000 per month per patient. So it's not something you can do for oncology. But going back to the point is like I don't think healthcare needs a solution for attractive or cool or AI related problems. I think we're still struggling with the basics. We're still struggling with the payment. We're struggling 25. One of the craziest statistics I ever read is 25% of the healthcare cost in the US, which is the biggest part of the US healthcare expenditure, the biggest healthcare expenditure in the US is for administrative tasks. Like, this is
Yeah,
mind blowing. This is, we pay for paper. We pay billions for paper and administrative tasks, and this needs to be solved before finding any attractive solution for anything else. Like, this is a problem.
100%. Yeah. Yeah, you nailed it. And there's two things that I would add to that because now I get on like my soapbox a little bit because you're so spot on. One of them is like if you're building a company in this space, you have to be a painkiller, not a vitamin. I know that's like a trite thing to
Yeah.
say, sort of we all know that, but you can't be a nice to have. So like at Latitude, we're like, okay, what we need to be in the core administrative functions of the health plan. We need to be something that the individual is using every day to make their lives better, such that we're adding so much value that we become incredibly sticky and we can never be thrown away because a nurse who's using Latitude says, I can never go back to the old way of doing things because this makes my job so much better. And then the second thing is just the things you mentioned, like the direct primary care model. We as consumers, at least in the US, have been so trained to not spend money on healthcare. Like I'll go spend money to like buy airfare tickets some way and like won't think twice about it. Like just that's the price. But you ask me to pay like $50 extra a month to have more access to my PCP. I'm like, no, no, it's just not how we've been trained from a behavioral
Yeah.
economics standpoint. And so you can have these great solutions. And I always ask other founders, I'm like, who's going to pay for it? Because if the
Oh,
payer's not going to
yes.
pay
The
for it or the
most
employer's not
important
going to pay
question.
for it, then you can have the great technology in the world and it doesn't matter because I'm so trained to not pay for it. And if you want the health plan to pay for it, you better be very, very clear on how it's going to save them money and how it's going to generate ROI. And again, not just be another point solution or data point, because I've asked this question working in health plans. You look at all the things that you do and you say, okay, well, together across all these solutions, we save some money, but I can't point to exactly which one of those was the thing that generated that ROI.